Well, hello and happy PA week. This is Dr. G. I'm here with my friend Tracey Piparo. Sorry, trying to get my Italian accent in there. And we're here to celebrate PA week. How are you this morning, Tracey?
I am awesome. Thank you for finally making this happen and for getting up early
Yeah, she's over there
and
in
still
Jersey.
looking great.
Look, I have a makeup team like Cardi B. No, I don't. I'm joking. No, everyone, we're so happy to be here. We've been planning this for a while where I wanted to learn more about physician associates. They have an upgraded name from physician assistant, but it's going to take time to get that together. But I just wanted to raise awareness because PAs can be a part of the hospice team. They can do the symptom visits for us, and I would love to see them more. I work with PAs in my training. My first experience is when I have my cabbage experience. They were down there harvesting the veins from the lower extremity that we put on the heart. I was first assist. Sorry, Tracy. Uh, I was at a community hospital for my
That's awesome.
medical school training, so I was able to be right there with the attending. And then the next experience I remember is on cardiology, my other favorite rotation. And this particular PA ran the cabbage patch. That's what we call it. And so, different hospital, different months, but PAs are an important part of our healthcare system, and I would love to see more of that. So we have the Presidente of what is the organization? Because I learned a lot of mnemonics and acronyms
All
today.
different acronyms. So yeah,
Acronyms.
we're I'm president of PAHPM, which is the Physician Associates in Hospice and Palliative Medicine. I just took over in September from Ryan Baldeo, who has done an awesome job as president and will be coming back as president next year. So we're kind of leading as a dyad, and we have a great board with us this year, hoping to really keep pushing PAs forward in the world of palliative med and providing some education for our members and other folks. And like you said, really keeping the message alive that we can and should be able to function in the world of hospice too, since there are some limitations to what we can do right now. But we're definitely out there and want to be part of all this.
Awesome, awesome. And then Tracy and I met. I always share, Palliative PA, your Palliative PA. That's who she is on Instagram. But where did we meet? Was it at the Academy, the annual assembly, or was
Yeah,
it
I think
in Arkansas?
no, I think we finally met in person at AAHPM. Did we meet in Arizona? Was
I
it
think
Arizona?
so because I have
Yeah,
two
I
pictures
think
where I
that was the
like
first time. Yeah.
I like sneaked behind you and got my selfie.
Yeah, yeah.
Yeah,
It's always meeting those social media friends in person. You're like, "Oh my goodness."
it's like you're a real person. That's what I love about us. We're all across the country doing things. So let's just jump in because in preparation for this podcast, have learned so much about physician associates. And so I want to make sure everyone, understands what that is. A lot of times in the work that I do as a mobile concierge physician, people say, oh, they want to see a doctor, or we have some groups around medical groups that have nurse practitioners. Um, and sometimes the baby boomers, they don't really get all that. They want to see the doctor because they're old school. And
Yep.
that's not derogatory at all. But my purpose here is to educate and empower and make sure everyone knows who's who on the team because you should know who's seeing you. And I'm really excited about physician assistants. And the story I have about it is what we can learn through the story. So let me open up these notes. Is let me go ahead and let you set yourself up. Give us the 30-second bio of your palliative PA.
Yeah, so I've been a PA now coming up on 24 years. Um, it's been an awesome experience. I initially started in emergency medicine, did that for just about 16 years or so, a mix of full-time, part-time when I had kids. I did a short stint as a hospitalist, which was great. I learned a ton. I also worked a ton. And I think between those two experiences, realized the need for having conversations that became known as doing primary palliative care. Like I was doing it without even realizing it. And when I thought about what I was doing, I'm like, I really like this stuff and more people need to do this. And how do I do this all the time? And we had a growing palliative care team at my institution, and I became friends with them and was just like, one day when you have another open position, like I want to come work for you. And it was hard. It took about 2 years until they had an FTE available, and it was kind of breaking through some barriers because initially it was posted as an APN position. I applied for it as a PA. It was a lot of educating the system that PAs are able to function in any specialty. And I became the first PA to work in specialty palliative care in the state of New Jersey.
Woohoo! Yes.
Yeah, there's now 3 of us that I know of. I'm hoping there are more that I may not know of. So if you're out there in New Jersey doing specialty palliative care, shoot me a message.
Yeah, or if, your young adult children or graduating high schoolers, they may want to take this path. Everyone has their own path. So let's just jump into some of the topics we want to, hit today.
Yeah.
Um, let's see. So let's first start with um, the training. I learned from this that the training of a physician associate follows a medical model. And I remember when I had decided that I wanted to go to medical school and become a physician, I remember one of the counselors said, "Ooh, why don't you go to PA school? You'll be done in 3 years." Is it still 3 years?
Yeah, so most programs are anywhere between 2 and 3 years.
Mm-hmm, mm-hmm.
And yeah, following the medical model, like you said.
And what does that mean so everyone knows? Because people don't even really know how medical school works.
Mm-hmm.
I'll
Right,
share just
right.
quickly. We have 2 years of didactics, meaning learning everything on paper about the human body, medicine, just everything. If any of you went to college, imagine finals week. That's every single day
Every day.
for 2 years. And then we take the step one board exam. We have to take steps 1, 2, and 3, USMLE, to get a medical license in the United
Mm-hmm.
States.
Right.
And so that's how that works. Then the second 2 years, we're doing rotations in various hospitals and doctors' offices so that we can, that's our classroom, being
Mm-hmm.
trained to be an undifferentiated physician. So anyone who graduates with an MD or DO should be able to, minimally do a surgery if we're all dropped off on like the show Lost in a jungle, you know,
Yep.
we're, be able to deliver a baby. I stay ready to deliver a baby on an airplane, just all that stuff. And so then we do specialty training and residency so then we can then do all that stuff. So tell us about how it works for PA
Yeah.
school and where should they
So
start? Like if someone decided today, I want to be a PA, what website do they go to learn?
yeah, so great questions. Again, in the medical model, so most PA programs follow the same idea of med school where you're doing your didactics and then you're doing your rotations. The difference is it's a little bit abbreviated for lack of a better word. So you're getting 2 years of didactics. Most PA programs are 1 full year, 12 months of didactics, and then 12 months of rotations. And following the same, mandatory and available elective rotations that med students do.
Okay.
We learn right alongside them. There are even some PA programs that for didactics, it's you're sitting in a classroom with the med students. So, the PA students and med students are taking classes together. So we're trained as generalists. So we graduate, like you said, being able to practice medicine, kind of knowing a little bit about a whole bunch of stuff. Um, if I always tell people that are interested in the PA profession, there are a couple of really good places to get information from. The first one is AAPA, which is the American Academy of Physician Associates. And that's our big, like, lobbying body and who comes up with our standards of care and things like that. They have information on anything you could think of. They also have a student academy, which I think is awesome because you get the perspectives from the students, and they do a lot of, what does it look like to be a PA student? The other place to look at is NCCPA, which is our national certifying body. And that'll give you a lot of information on how our PA certified. What are you going to have to go through? We graduate, but then we have to take our certification exam and pass that in order to get a license in whatever state. So it's sort of like taking the USMLE, but it's just one test instead of 3 steps. And then you need that to get your license in whatever state you want to practice in. And just like board certifications for MDs and DOs, we recertify. It used to be every 6 years. It changed to every 10 years. So we recertify with an exam. And every 2 years in between, there's CME that needs to be done in order to keep that certification up. The other place that is helpful to look at when you're thinking about PA school is PAEA, which is the Education Association, which will give you tons of information about all of the wonderful PA programs, because there are a lot out there.
This is wonderful. That makes me want to forward, this podcast to like high schools, because I see so many young people who have the world ahead of them. They pick certain things just because that's what they're exposed to. I was there,
Mm-hmm.
you only can be what you can see. And I think if they knew about these things, they could pick these professions early,
Yeah.
and then we could increase the workforce, which we all need, today. So thank you for explaining that to us. Um, you mentioned, how you came to your role and how it was an APRN role. No, not APN role. What's that
Mm-hmm.
acronym? Advanced
Uh,
practice.
advanced practice nurse. I think everybody uses them kind of interchangeably, like APN, NP, APRN. I think it has to do with their certifying bodies. I'm not.
Right.
Yeah.
And then I previously did some work with Optum, like doing the Medicare home visits. They call
Mm-hmm.
them advanced practice practitioner to kind of.
Right, or advanced practice providers or advanced practice clinicians. I
Okay.
think a lot of, like, APCs, I think a lot of places use those acronyms to um, put the PAs and nurse practitioners together.
Yeah.
I'm a big person on, like, separating them just so we all know what our role is. But I know a
Okay.
lot of organizations use APP or APC when they're referring to both PAs and nurse practitioners.
Interesting. Interesting. I don't want to get too far off into the deep end, but then I know there's been a movement using the term provider. So
Mm-hmm.
then I don't know where that came from. I personally don't use that because I want people to know they're seeing a physician.
Yep.
Um,
Agree.
but yeah, let's not go there. Let's get back into how you get to this training. So, since you're educating the healthcare system, again, like you shared while we were preparing, so a lot of the job postings are not even showing that you can do it when you might be the right discipline for certain roles. I would think. Um, so okay, let's go into the scope of practice.
Yeah. So, for the easiest way to explain it is what PA scope of practice is really determined at the practice level with the team or the physician that you're
Mm-hmm.
collaborating with.
Okay.
So if I'm working in cardiology and my collaborating physician is a cardiologist, then I'm going to do all the cardiology things, all the things that that physician is doing, which is different than if I'm working with a nephrologist or an OBGYN. So a lot of states have moved towards having practice mandates, through the licensing boards and things, saying that the scope of practice is determined at the practice level, as opposed to having some, laundry list of things that PAs can and can't do, because you're inevitably going to miss something. Like, again, it
Mm-hmm.
goes back to that idea of being trained as a generalist,
Yes.
and the difference with physicians, like you can attest to, we don't come out of school and do a residency, where we specialize in something. So we have that lateral mobility. I went from ER to a hospitalist to palliative care, um, where a physician would need to do different residencies or a fellowship. There are a lot more now becoming more popular fellowships for PAs, where they can get extra training in certain areas, such as critical care, palliative medicine, different surgical subspecialties. So I think that's going to become more popular,
Mm-hmm.
just as a way to be I think some of it is to be a better candidate for jobs, but also to, just beef up training and have more confidence and be able to function as part of that healthcare team.
Yeah, you all, you were sharing with me you're focused on collaborating and being a part of the healthcare team, which that's what we do, right? In hospice and palliative care. I think
Hmm.
it's fantastic. Um, uh, I recently saw you posted going to the CAPC seminar, and I think you mentioned that you were doing some research. You want to share a little bit about that?
Yeah, so CAPSI was great. It's the first time they've had it in 6 years. So I was super excited. I think there was a lot of energy there because people were excited to be back in person again and have stuff to do. We
Mm-hmm.
had we had some posters there through PAHPM. We had done, kind of a needs survey for our membership, and especially for our student members, to say, what would be important to you? What is your understanding of palliative medicine? What would be important to you to get from being part of an organization like PAHPM? And our student director, who, shout out to Rachel, will be starting a palliative fellowship in October,
Congrats.
um, worked real hard to put a poster together that CAPSI accepted, and that was awesome. Our immediate past president, Ryan Baldeo, had two posters there also, which was great. So it was really awesome to see PAs represented. I'm the crazy person running around looking at people's name tags. So I did find three other PAs, and I was like, where are you? Where'd you come from? So that was really awesome. I myself, the past 8 months now at my institution, have been doing some research as providing palliative care in the emergency department, and attempting to show that the earlier that we can engage with people and families, the better it is for everybody. And health systems like to know about money and stuff, right? Like, they have their metrics. So we're trying to prove that we can save on length of stay. That, hey, if we can engage these people earlier and have conversations and provide better goal concordant care, maybe we can save on the back end through length of stay. And everybody knows, if we can get folks out of the hospital faster, it's better for people, it's better care overall, but we're also saving money, even though we don't like
Yes.
talking about that.
Right. But everyone, you need to know healthcare is a business.
Exactly,
We're not the
exactly,
rich ones. It's the
exactly.
institutions, the insurance companies. It's still a business. And so we
Yep.
accept that reality. And you're the consumer. That's the other side of that. I always tell patients, you're the customer. And then they go, oh yeah. When I'm in my advocacy and empowering mode,
Yep.
it's like they're like, oh, I do get to choose. Yes, you do.
Exactly.
Yeah.
Exactly.
Yeah. And so I love this. My wheels are spinning here. I actually now remember meeting a PA at a conference, and we were talking about doing some collaboration. One thing that was concerning, and I want to talk about, um, getting into scope of practice and autonomy, because I think
Hmm.
that's important given the numbers of people who need to be served, in our hospitals and our doctor's offices. I do home care, so I'm not in the competition, but I hear, people can't get an appointment for 6 months, 3 months with their doctor. They can't get the care that they need. This is not going to get any better. So we need to figure out creative ways to, of course, keep healthcare quality there. We're never going to compromise that, but we need to figure out ways to collaborate and maybe encourage or advocate for autonomy, because PAs are very, very well trained, from my experience, from the stories I shared, from the coronary artery
Yeah.
bypass graft. That's what we say cabbage is for the lay people listening. When you get a bypass surgery, and then the cabbage patch, when they're recovering in the CCU. Um, what can what can we do to help advocate for that autonomy? And before you answer that, I just want to share you shared a story, how you had a colleague who, lost their livelihood, been working, and then their collaborating physician had a tragedy, and so then they were out of
Hmm.
work. That doesn't
Right.
make sense to me. Like a whole clinic shutting
Yep.
down and people
Yep.
losing access to healthcare um, because of that. And so those are
Yeah.
the realities. So let's kind of talk about that whole thing.
Yeah, I think that's a lot of what folks don't understand is that in a lot of states, although there are some that have updated, which we can talk about, in a lot of states, my license and keeping my license is dependent on me being, for lack of better word, attached to a physician. In order to have my license, I have to prove that I have a physician who is willing to collaborate with me and kind of be responsible for my practice. Um, so, what has happened to some people is that, just like you said, it's a PA and a physician in a clinic in, maybe an area that doesn't have a wealth of healthcare available. And the physician died unexpectedly. Well, that PA, per the licensing of that state, can't see patients because the physician's not available. And it's not that I have to have a physician right on top of me and looking at everything, but it's you have to have someone who is available when you need them, right? There are days where I don't see my physician at all. But this person couldn't keep practicing because they didn't have a physician, and it took a couple of months until they could find a physician that was willing to come work in that clinic with them. And those were months that a panel of, what, if you're talking to a family practice clinic, it's probably 2,000-3,000 patients that didn't have any health care. Not
Oh,
that nobody wanted to take care of them. You had a PA there ready and able, but because of the restrictions of the laws, they couldn't do it. So what AAPA, and a lot of PAs, what we're recommending is really to move toward a place where we don't it's not pushing for what everybody says independent practice. It's pushing to be truly collaborative and
mm-hmm,
to say, I want to be part of a healthcare team. I just don't want to be tied to one physician. I want to be able to practice at the top of my license. Anyone, even a physician, should be practicing collaboratively. We can't all possibly know the answer to everything
mm-hmm,
ourselves. And what lots of states have instituted, I think North Dakota and Wyoming were like two of the most recent ones. There's only about 5 states that have done it, is after a certain amount of practice in a specialty. So for example, if you've been practicing family med and you've been doing that for 5 years, and the physician that you've been working with is like, you are proficient at this and we work together as a team and you know what you're doing, your license is no longer dependent on having that physician, also on your license. So it's, but only to practice family medicine. You can't say, okay, wow, now I can practice all by myself and I'm going to go hang a shingle and be a dermatologist. Like,
Of course
absolutely
not.
not.
I mean, but you
You know,
can work
absolutely
with a
not.
dermatologist. You can show up
Exactly.
with your
Exactly.
license active
Exactly.
and
Right.
work just like any
Right.
other professional who
Right.
has, all the disciplines, the
Right.
CNAs, the MAs, the
Yep.
RNs and all that stuff.
I think a lot of it is just, there are plenty of people out there that need care. And I think we have to find a better way to be able to get the the carers, to get the care people, to get all of us clinicians to the people who need the care. And there are just too many barriers right now that are very, very difficult hoops to jump through.
Well, I am definitely on board. I entitle myself as an healthcare advocate, and supporting PAs for me, that to me is a no brainer. I don't. I That's a no brainer.
Yep.
So I'm actually shocked at all the things I learned here. So when you all get your training and you get your license, then you take this exam, or do you have to take this exam at
You have to
NCCPA
have,
first?
yeah, you have to pass the exam in order to apply for your license.
Yeah, and this is where I learned. This is where I got the 1974 from, right?
Yeah.
Okay. Oh, this is fantastic. I'm trying to see which one we should pick for the valuable resource today because we just learned so much about uh, your industry. We're going to pick where you're the president of because I should have been calling you Madam President this whole time. My apologies.
It's all good. All good.
No, so happy to have you here. And then your background there is so relaxing. Is this your backyard?
Oh, this is my backyard. Yeah. It actually is a seasonably nice day here in New Jersey. So I was like, I'm going to sit outside. It's nice and quiet, except for the
Wh-
random plane that flew over before. But
what does that seasonably nice mean for New Jersey? Because I'm a California
uh,
girl.
yeah, I know. I know. You with the sleeveless dress on. Right. I will say right now, I'm actually looking. It's 71 degrees, but it's
Oh,
nice and a little cloudy. But this is my favorite weather. It's like throw on a little bit of a sweatshirt, but I don't have to be too cold, but I'm not too hot. This is
yeah.
perfect. But it will inevitably change and we'll be freezing in like 3 or 4 weeks.
Well, 71 is like summer to you because that's like perfect LA weather. You know what I
Exactly.
mean?
Exactly.
Um, yeah. And so, fun fact for this, I've been to New Jersey to go to the New York Jets game, my firstborn. Are you a football fan of
Yes, but
anything?
we're Giants fans.
Don't say but. That's their choice. Because I know you're from Brooklyn, right?
Yep. Yep. So
Okay.
Giants and Mets, and sometimes life is painful.
Okay. Hey, we all everyone has their team story, so I love to share that, especially since it's football season.
Yep.
Uh, I have my LA Rams, so
That's right.
this
That's
is
right.
the exciting time of year for all of us. But I appreciate you and all the things that you shared today. I'm going to put all these things in the show notes so people can go and learn more about physician associates and we can continue to raise awareness. And happy PA week to you.
Oh, this is awesome. I thank you so much, Dr. G. This is great.
Yeah, my pleasure. Anything you want to say as we wrap up, you get the last words.
Yeah, I think just check out our website. Check me out on Instagram. I know you're going to share that. Always sharing lots of information. Instagram, LinkedIn, anything that we can do to kind of push PAs in this space forward. And happy to always answer questions.
All right. Well, thank you for another episode of Dr. G at the Heart of Healthcare Season 3. And I am just so relaxed with the birds and everything there. So you're making me want to go sit on my patio. So, all right. Well, you have a great day. And
You too. Have an awesome day.
all right. Peace.
Bye.